I have two special guests with me, and both of them should look completely exhausted, and I'm noticing that neither one of them do. So it's very grateful to have both of you here. First, you've got Elizabeth Hoff, who is the head of our country office in Syria. If you are a regular World Health Plus Social Good viewer, you know her well because she is a regular on our show. Alongside her, I've got Dr. Ahmad Shadoul, who will become a regular on this show, I fear. He is leading our response in Yemen, where he is the head of country office there. You'll remember the conflict there started in March, so he was there before. He can do a compare and contrast for you to talk about what the health system was like before and what it is like today. Elizabeth, let me start with you. Give us a quick update on where you are with the emergency response in Syria. Are you able to get medicine and other supplies in? What's the latest?
Thank you, Christy, and thanks for inviting me to your show. I would say that the response work in Syria is very difficult because the security situation is deteriorating. There is an escalation of the conflict throughout the country, and we have 50% of the country now under armed opposition groups, so the government has lost control. And this is just telling us that it is very difficult to do response work when you have armed conflict. And what we have managed to do is a needs assessment on which we have based our response work. So we know that we have around 25,000 newly wounded every month. So we are trying to help the hospitals to get ready for these emergencies and to get trauma equipment and surgical supplies out to the hospital. Then we have also to take care of vaccination during emergencies. It's very important. We had the outbreak of polio, as you know, in 2013, but we were able to put that behind us. The last case we had was in January 2014. So we are again in Syria polio-free. But the routine vaccination is very important. It used to be 95% coverage, the best in the region, but it has unfortunately dropped to between 50 and 60%. So it means that when we have 3 million children under 5, 1 million of them are not vaccinated, and more than 1 million. So we have to step up to this task. We did 15 campaigns against polio, and we managed to reach almost all the children around the country. So the task we have ahead of us now is to step up and make sure that we get all the support that is required from partners. The closest partner we have is Syrian Arab Red Crescent Society, which is actually reaching across the country to not only the government-controlled area, but also every corner of the opposition-controlled area, as long as it's safe and not too much conflictual activities, armed conflict activities going on. But we are also partnering with 69 NGOs. These NGOs have the huge advantage that they are known by the community, so they can reach out to where the people are. We have problems when you asked about the response work. It's really that 7 million of the Syrians today are internally displaced, and we have 4 million who have left the country since the conflict broke out. And the issue here with the 7 million is that they are either staying with the Syrian families or they are staying in the shelters. So the problem with clean water has become very urgent to address. Many of them, particularly around Aleppo and in the eastern part of the country, have no access to clean water. And the people who are living in the shelters, many of them are sharing a toilet. There can be as many as 50 to 70 people sharing one toilet. And we know that together with vaccination, which is the most important to prevent communicable diseases, but the important part is also the waterborne diseases. So it's very important for us to inform the people about, the steps they can take to protect themselves. And here, hand hygiene and, cleanliness throughout is important, but it is difficult when you don't have clean water and you live in overcrowded conditions. So WHO, together with its partners, is playing a very important role in health education messages to prevent. And the good thing is that we have been able to prevent any outbreak of cholera. But this is also because the Syrian people is highly educated and they have known to protect themselves since a long time.
Several questions there I want to follow up on.
Yes.
The numbers are staggering.
Yes.
The numbers are really mind-boggling. But let's first start with the hard-to-reach areas.
Yes.
You mentioned there's 50% that you don't necessarily have easy access to at times. How do you maneuver in those situations to ensure that you can get the medicines, the supplies, the vaccines, everything to the full population?
This is the crucial issue for us to succeed with the response work. Now I would say that we have around 4 million people in Syria living in the hard-to-reach areas. And access is the problem. But what we are doing, as I mentioned, we work with partners, the Syrian Arab Red Crescent Society, which has access, and also these 69 NGOs, local NGOs, and community groups that we have actually gone into partnership with. So they are helping us to bring the medicines out. And when we have difficulties passing checkpoints, we have to come up with very innovative solutions to make sure that these medicines are reaching the corners. We are also using private sector, but it is also difficult for the patients to access the health services and also for the health workers to reach their workplace. So it's not just a question of getting the medicines and the supplies out, but when there are sort of heavy armed conflict, then all these movements are difficult. But what has impressed me since the beginning of the conflict is really how dedicated the health workers are. We have 50% of the health workers who have left the country, but the other 50% that are remaining are very dedicated to their job. They show up. And what we have seen in hospitals, for example, that they are working now on a weekly schedule, that the health workers are staying for the whole week in the hospital and then they go home for 1 week. So that this is reducing the burden on them with the risk of moving around freely. But while these health workers are at work, they worry about their children that have to go to school and the difficulties when they are not around as a mother and a father to protect their own children. Right. So there are so many components and assets to a conflict that we don't think of when we sort of look at the sort of detailed picture, but there are always other components that we need to worry about.
Very powerful insight there. Dr. Shadoul, let me come to you. You were based in Yemen before the conflict started. Talk to me about what Yemen was like then for health, what Yemen is like now.
Oh, thank you very much, actually, for inviting us for this show. And in fact, Yemen was one of the favorite and good places. And there is a very common proverb that says, they call it Yemen Said, which is happy Yemen. But unfortunately, that's not the case now. But it was good. We were reaching everywhere. There were nice beaches. Old Sana'a was amazing. You have many places to visit. The health system was not that very efficient, but still there was good services. Vaccination coverage was almost 88% in 2014. There was a viable fleet of ambulances doing a good job, and many universities who are really doing a good job as well, and well-capacitated human resource health workers in different places. And the government was spending about 4.5% of the GNP on health, which was, compared to the situation of Yemen, was quite reasonable. However, this has changed completely since March. And now we have almost 25% of the facilities are no longer functional, that many of the health workers, like what happened in Syria, are no longer reporting to the health facilities. There is no fuel. Ambulances are no longer moving. There is no electricity. Many of the hospital or the major hospital are no longer functional. There is a complete lack of medical supplies and equipment. The coverage of vaccination has dropped dramatically. Vaccines are in danger because there is no electricity to keep the cold chain functional. and about 1.4 million displaced inside Yemen in an unhygienic situation, actually. And there is lack of clean or safe drinking water and sanitation and hygiene in those places where they are staying, which is could be also a source of disease outbreak. On the other hand, this is the rainy season in Yemen, so you will find actually breeding for mosquitoes, for flies, and this is another threat for disease outbreak. The most serious part is the inaccessibility. For Yemen now, we were not able to access Yemen, and inside Yemen also access is almost impossible to so many places, especially in the rural areas where more than 70% of Yemen population are living. So the situation is very difficult actually. The facilities are no longer efficient and functional, and we cannot reach everywhere. And even the private sector is no longer now importing drugs and medical supplies and equipment. So the whole system now is at risk of an imminent collapse actually, and is almost mainly dependent on WHO in providing the support.
Thank you both for coming by. Really, the challenges you face day in and day out are overwhelming, I can only imagine. And yet, you both are so humble about it. And I want to thank you both for the work you're doing, because it is really amazing work, and you are saving lives. And I know you're up against amazing challenges that seem like there's no end in sight, but we're very grateful. Thank you for what you do.
Thank you.